Good morning. This is Dr. Tarek. Today my topic is ear. Ear is divided into three parts: external ear, middle ear, and internal ear. The external ear is commonly known as pinna. It functions like a antenna of a TV. It attracts the sound waves and directs them to the eardrum through the external auditory canal. This is known as ear conduction. When these vibrations reach to the eardrum, that vibrations are transferred to these small bones. There are three small bones in the middle ear. Their names are malleus, incus, and stapes. This is malleus, this is incus, this is stapes. And this vibration then reach to oval window. They are attached with the oval window. Oval window is attached with the cochlea, and cochlea has organ of hearing, organ of Corti, and also there are lymph inside the cochlea, and three semicircular canals are attached with the cochlea. They also have lymph inside. They are concerned with balance of the body, and cochlea is concerned with hearing. So these vibrations then reach the cochlea, and the organ of Corti receive this vibration and send them to brain via its cranial nerves, and then brain interprets what is being said. In the external ear, when sound waves enter the external auditory canal, this canal has hairs, these small hairs, and earwax, which is known as cerumen or earwax. Earwax is sticky. This is defense of the middle ear and the internal ear, which are sensitive organs. So it has hairs and it has earwax, which are sticky. If dust particle or some microorganism try to reach inside, they catch them. And in the middle ear there is a canal which connects middle ear with the throat. This is known as Eustachian tube. Eustachian tube. So there is pressure inside and then there is pressure outside. So internal and external pressure is balanced. There are some words for the ear, and this in this middle and internal ear is inside the mastoid process, which is a part of the temporal bone, and it has air filled cells. If infection occurs in this area, that is known as mastoiditis, and if infection occurs in the internal ear is called labyrinth. So infection is called labyrinthitis, mastoiditis, and labyrinthitis. We have some medical terminology for ear. Number one is oat. Number one is auto. It is external ear. So we can have otitis. Otitis is three types. Otitis externa, otitis externa, otitis media, otitis interna. External ear infection, middle ear infection, and internal ear infection. Then we can have otorrhea. Otorrhea, fluid discharge from the ear. We can have otorrhagia. Rhagia is blood, hemorrhage. Whenever you have rhea, think of diarrhea. It means fluid. And whenever you have hemorrhage, whenever you have rhagia, think of hemorrhage, that is bleeding. So otorrhagia is blood discharge from the ear, and otorrhea is fluid discharge from the ear. Otopyorrhea, otopyorrhea, pi means pus. So pus coming out of the ear. Otalgia, pain in the ear. Otomycosis, otomycosis. Myc is fungus, osis is abnormal condition, and auto is external ear. So this happens in swimmers. This is also known as swimmer's ear, because when they swim in the water, this water is not clean and they get fungal infection of the external auditory canal. That is known as swimmer's ear. Then next word is tympan or meninge. These are two word roots for eardrum. It can rupture tympanorhexis. We have to stitch it tympanography. We have to repair it tympanoplasty. Sometimes there is infection in the middle ear and there is fluid or pus accumulation inside it. So this is eardrum. So we have to make hole in this drum and pass this small, very tiny tubes inside, and then this fluid is drained, or if pus is there, that is drained. This is known as meningotomy. Meningotomy, cutting into the eardrum, or meningostomy. Meningostomy. Stomy is surgical opening. So pus is drained and pus serous fluid is drained from the middle ear. We can also repair this eardrum if there is rupture, there is due to injury. This is known as meningoplasty. In the middle ear, we have a syndrome which is known as Meniere's syndrome. Meniere's syndrome it has three cardinal symptoms. One is vertigo. Number two is fluctuating hearing loss, and number three is tinnitus. So this is all about ear. Thank you.